Hello, my name is Paul Weddle. I work on behalf of Millfield Medical Centre, a GP surgery within Sunderland. We've been approached by Healthwatch Sunderland to answer a number of questions that's been given to them by the patients. Obviously, I can't answer those questions on behalf of all the GP practices in Sunderland, but I can definitely give you our view on those answers, and hopefully they will give clarity on some of the situations. We have definitely seen an increase in verbal abuse to the reception staff during the COVID-19 period. We are following a system whereby we continue to observe zero tolerance. If they continue after at least a warning, will be removed from GP practice. With the regulations changing constantly, with the different tiers and the different rules, unfortunately these rules change quite regularly because of the different tiers. We will try and explain as best we can, and we just hope that the patients will bear with us and consider that we are dealing with this at the same time as them. I can categorically say that this has never been the case. GP surgeries have always been open. Now, on occasions, patients have to get in touch with the GP surgery by telephone rather than being able to walk through the door, but the surgeries have always been open for care and for contact. Due to COVID-19, and especially due to the shielding patients when they had to do this in the early stages of COVID, we've changed our appointment system to a telephone triage system first. That doesn't mean that you can't see a face-to-face GP, it just means that you have to be speaking to a GP first, or at least a clinician first, to decide whether it's appropriate for you to come down. There's a number of other alternatives to get in touch with us. There is video, there is a system called e-consult, the electronic version whereby you can send the information to us. We pick that up within 24 hours and then come back to you. You can also register to do online services, so you can book appointments online, you can order your prescriptions online, and also see any test results. That again frees up time whereby you can approach us at a suitable time to you rather than just within our opening hours of 8 till 6. The easiest answer to that really is the nurse does an action, so therefore the nurse would take a blood test, or would take a blood pressure check, or would do an ECG. Whereby on occasions when you're speaking to a GP, you don't necessarily have to see the GP to get a history. Now, if the GP feels that you need to be examined, then yes, of course, that would be a face-to-face appointment with a GP. But again, once the GP has got the history, and therefore that face-to-face appointment is kept to a bare minimum. Some of the aspects of our work at the moment have been put on hold. Now, that's sometimes because of the risk of COVID-19 and the face-to-face approach that we have to be careful of. And because at the early stages, certain tests weren't allowed to be done, we've now got a slight backlog that we're working our way through. So things such as an NHS health check that can be given to patients are being just held off until after the new year.